everybody, and welcome to another episode of the Roundtable here at mycountylink.com as we bring you interesting people, places, and events that take place not only here in Darke County, but also around West Central Ohio. I'm Alex Warner, along with Gaylen Blosser, Mike Stegall over here on my left, and our guest today, President and CEO of Wayne Healthcare, Jeff Subler. And Jeff, first of all, welcome. We know you always have a busy day, so it's nice to have you with us here.
I appreciate you having me. Appreciate the opportunity.
Yeah. Let's talk a little bit just about your background in brief, and then we'll get into some things that have arisen here. Some rumors out there we want to lay to rest here as far as Wayne Healthcare.
Absolutely. Well, born and raised in Versailles, and that's where I still live with my family. And so from Darke County originally, and I'll be here forever. You know, that's the thing there. So I've been at the hospital for 18 years, and actually in my 5th year as CEO. That's flown by, but came up through the non-clinical side, I'll say, of the hospital, and worked my way up. I was a VP prior to becoming CEO, and I like to tell a story that I didn't say no fast enough a few times, so went into Shambo, and here I am.
And here you are. Huh?
Yeah.
I know, I think first time I ran across you, I think you gave a presentation at our Greenville Rotary Club, if I'm not mistaken.
Yep.
And at that time,
one of our projects.
Yes, it was. It was one of the healthcare projects there. So anyhow, a lot of stuff going on in the healthcare field right now.
Yes, yeah, you could say that. There always is, but boy, it's been a crazy handful of months here related to budgets, both at the federal level and the state level. And it kind of culminated in a report related to the Medicaid cuts that were being proposed at the time. And kind of unbeknownst to us, Wayne Healthcare ended up on a list of hospitals that were at risk, is kind of the title of the article. And, you know, in that article it mentioned closure. And I was going to say, you know, the headline grabber is closure.
Right.
If you actually look at the article, it says at risk of cutting services, conversion, or closure. But again, nobody ever saw, you know, they saw it. They only saw closure.
They didn't see the fourth option, continuing to be successful.
Yeah, that's right. That's right. So it's you know, we had to come out really and first talk to staff and say, hey, we're not at risk of closure. We're not at risk of cutting services or anything like that. Certainly, we were concerned in monitoring the proposed cuts to Medicaid because those do have an effect on us. And that's really was the run-up to that whole thing. We were monitoring the federal budget process through the American Hospital Association and other entities because we are a government payer, heavy government payer entity, like most rural hospitals are. So anything that anytime they're talking about Medicare or Medicaid reimbursement, we have to pay attention. And so we ended up on this report. We're really still not sure how that happened because I've not seen the report.
Do you think you got classified as one of these at-risk just because we're a rural hospital?
Yes.
I mean, that's probably the automatic qualifier.
Yeah. Most of them were, on that list were rural, and the only information I could find about that report was it was either, they said three years of negative operating margins or a higher than the top 10% of Medicaid payer mix in your peer group. I don't think we meet either of those. So it was one of those, you know, some Democratic senators funded this report and kind of, it was their way to blow it up to say, hey, you know, these cuts, if they're drastic, could lead to some of these things. So you know, from a payer mix standpoint, which is, you know, your mix of patients that have either commercial insurance, Medicare, or Medicaid.
Right.
Those are the 3 buckets of insurance. The 4th bucket is bad debt or charity. We have been a Medicare-dependent hospital for decades, and that to qualify for that, you have to have, I think, 55% of your business comes from Medicare patients.
Really? Is it that much?
Yep. And we're actually closer. We range between 60 and 65% of Medicare. Which we'll talk a little bit about critical access. That's the main reason why we went after the critical access status.
Is that because we're one of the older counties in
the state of Ohio?
I think we're what? Top 2 or 3 as far as.
Yep, I think our average age is 42-ish. something like that.
I don't know why.
Sounds good to me, though.
Yeah, that's fine.
And so then the other is Medicaid, and we range anywhere from 10 to 15% of Medicaid. Now, one thing that is different about us compared to some of our neighbors in adjacent counties is that is a higher percentage of Medicaid than Mercer County, quite frankly, even Shelby County, believe it or not.
Okay.
So we have a higher population of Medicaid that we serve. So that puts us in a little different category, which probably bumped us into that report. You know, we did have a couple tough years through COVID, coming out of COVID from an operating standpoint, like the majority of healthcare systems. But certainly we were not at risk, or that was not a event-changing, organization-changing event. We managed it and did some things as we went through that, like most hospitals. So the end result was we ended up on this list. We had to do some damage control to staff and the community and say, hey, we are very solid, very strong through the hard work that's been done for decades in the community and at that organization. And we've done a lot of change in the last 4 to 5 years ourselves that have really set us up for the future.
So you've tried to be proactive, even not knowing down the road the last several years exactly what was going to come down the pike, but you've tried to be proactive, get ahead of the curve on a lot.
Absolutely, absolutely. And you know, we talked about some addition projects. We opened our last addition in 21. So we ended up finishing that project right as COVID started, which was an interesting time. So we just opened that in March of 21. It's a brand new obstetric unit, labor and delivery, wellness center, and our inpatient unit. That was the main addition. So we opened that in 21, and then we're dealing with really the middle of COVID. And it seems like a long time ago, but it wasn't that long ago. But you know, COVID really hit us in our area, and especially the hospital, in those middle couple years. The first year, a lot of that stuff was, you know, everybody was figuring out what was going on. We actually transferred a lot of patients to the Dayton market. The staffing and the COVID numbers really hit in that mid-21 for the next 18 months. Our worst winter of COVID was that 21 to 22 winter. So we spent a couple of years there in the middle dealing with the staffing shortages and everything that went on with COVID. I don't want to relive that. So we did that, but you know, we also were looking at how do we set us up for the future. One of the big things there was we knew we needed to get on the Epic platform, which is the electronic health record. If you know my chart, that's Epic.
Excellent.
And that's the big. They're the market leader in the country. Is Epic, and all of our larger systems in the area have been on Epic. So that's Premier, that's Kettering, Reed.
It took a little while to make that switch too, if I remember right.
It took us a year to vet which product and which we had a couple choices to partner with. We couldn't install that ourselves. It's way too expensive. We're too small for them. So we have to partner with somebody. And we ended up partnering with Premier. It's called Community Connect. With their Epic platform. So it took us a year to kind of prep and plan it, and then it took a good year to get it implemented, installed, and working. So it was about a 2-year, certainly an 18-month process at a minimum to get that Epic up and running.
Now, one thing you mentioned briefly, talking about being proactive, critical access hospital.
Yep.
What is that?
Yep. So that was the other thing, kind of in the middle of Epic. We decided that we needed to take a hard look at critical access. And what that is, it's a program that was actually started, it's not that old, it was started in 1997 by the federal government in response to a bunch of rural hospital closures and rural hospital distress. Sound familiar? So they created this program called Critical Access Status. And what it is, you can convert to this critical access status. And it's meant for Medicare patients, Medicare populations. And essentially it puts you into they call it a cost-based reimbursement from Medicare. So what it means is we get paid more to take care of Medicare patients because we are a Medicare dependent hospital. You know, the rumor, the saying on our side is the government knows they don't pay you enough with Medicare, so they have these programs to give you extra money on the side. So critical access status puts you in a different reimbursement category for Medicare. And because we talked about we're Medicare dependent, our population is only going to get older. That is a demographic that we serve. Almost 2/3 of our patients are Medicare. So it's not easy to get into that program. You have to do certain things. You have to meet certain qualifications. And actually, they changed a rule at the federal level, and we started tracking this in late 2022. We had a consultant that told us that, hey, we're talking about modifying some rules, and if they modify the rules, we think you'll qualify. So we said, okay, we'll track it. So they made that change in 22. We were then in the middle of, we had made the decision to go to Epic, and that was a huge lift for us. So we said, we can't also do critical access.
Okay.
But we spent the next 6 months, the first 6 months of 23, doing our due diligence. What does it mean financially? What does it mean operationally? What does it mean from a community perspective to be critical access? So we went and talked to some other critical access hospitals in the state, and decided really we need to pursue this once Epic was up and running. So we got Epic up and running in September of 23. It's not a light switch. You kind of grow into that program. So we knew we had to wait at least 90 days.
Okay.
But early in 24, we said we've got to go after critical access, and we started that process. It took us about 6 months to get. You have to be reaccredited. You have to get approval.
That's a long 6 months, one.
Approval from CMS, all these things, and it was a tricky, complicated thing, but we got it done. Staff did a great job. So it put us in a cost-based reimbursement for Medicare. So from a financial reimbursement standpoint, it puts us in a much better position.
Yeah, so again, you're proactive, got ahead of the game instead of waiting until everything came down. Gaylen, you got anything you want to?
Yeah, I do. A disappointment for me from time to time over the years has been that people say our BandAid Station, the BandAid Station. My wife's been in the emergency room. I've been in the emergency room. My kids have been. We have got 100% perfect care. I guess if there's a silver lining in this, I'm now hearing, oh, we can't lose our hospital. What is the perception? I'm pleased with the hospital, always have been. Do you hear that?
Yeah, not as much, which is good because, like I said, I've been at the hospital 18 years. That's always been a perception that we've been battling. I remember my predecessor, Randy Shambo, and the board talking about that a lot. How do we better that perception? How do we share the good things that we're doing? So it's been a very, very strong thing we've been working towards to kind of battle that perception. And we're not going to please everybody. We know that, but we are not a BandAid Station. We are so much more than that. And it also becomes, a lot of times people are coming to you don't go to the hospital if you're having it's a sunny day, I'm going to go to the hospital, right? So you're going at a time of need, or some people, I got to go do this test or do those things. So we understand that it's not always a pleasant thing that you're coming to our business for. And I think sometimes the other thing that happens with that perception is we also know what we are. We can't do everything, we don't do everything, and yes, if someone is coming in and needs a higher level of care, they will get transferred to a Premier, or they may go to a Reed. That's a good thing.
Mm-hmm.
We understand we will provide the services that are appropriate for us, and we provide a lot for a small community, a city of 13,000, a county of 52 or 53,000. We provide a lot of services, but we have a lot of partnerships and friendships that I call them, that we work with others to get you to that next level of care. But the folks that we do, whether it's an emergency room, we still do labor and delivery. We want to keep that service going, and you've read a lot about those closures and what that does for communities. To our surgery program, just fantastic surgery program, especially our ortho program.
Yes.
With our partnership with Orthopedic Associates. We've doubled our orthopedic cases in the last 2 years, and it's still growing.
Yeah, a lot of people want to know, so what's your tie-in with Premier or Kettering or Family Health? A lot of people, Family Health, Wayne Healthcare is one and the same.
Right, no, two completely separate organizations.
Exactly.
And any rural hospitals, and we're in the same, but you can't just stand there by yourself and you have to have these partnerships to flourish, and that's across the country. And what you're also seeing is sometimes if you don't have those partnerships or don't have them available, that's when hospitals get bought up or they merge because they have no choices. And sometimes those mergers lead to a decrease in services for your area. But we actually have a contractual relationship with Premier that was started, about 8 years ago. We're not an affiliate. We're not part of their system. All the control, and we manage it locally, and that was a huge component of the agreement. We want to keep all that management locally at the board level. But we also recognize, and I give credit to the board at the time and my predecessor, Wayne DeChambeau, hey, we can't just stand out here and ignore what's going on in healthcare. We have to look for partnerships that support each other. So the agreement really, was predicated on, hey, Premier, you're a larger system with more resources. You've been doing this a long time. You have access to different service lines and specialties. How do we work together to strengthen those partnerships where maybe if it's a certain service line we've not had a lot of contact with, how do we strengthen those direct relationships so that if a physician needs to consult or send someone, we have that set up. So a lot of clinical partnerships, clinical relationships were developed out of that. And we had some, but we should really strengthen that. The other is even just on the back office side, what resources do you have related to consultants or the revenue cycle? We're having this issue with this payer. Can you help us with that? To software, to purchasing, those types of things. So it was really a broad range of things like that. And so that's been a great relationship because it's been, I call it hands off. It's collaborative. It's not Big Brother telling us what to do. We can ask, they can inquire, but it's a very collaborative relationship.
Mike, you've availed yourself of the services. I always say 5 different
I
scars.
got 5 different scars from Wayne Hospital. Well, one thing I have noticed is I was commissioner when Premier came on, and to the whole county, to me, that seemed like a big deal.
Yeah.
And what I am hearing from a lot of people now is there's 2 things now that Wayne Hospital is really known for. One is your orthopedic care through Orthopedic Associates, who they do a fantastic job. I'm a walking proof of it. And the other one is the Cancer Center.
Yep.
Explain a little bit more how that's. I remember when that started too. McKellar, Dr. McKellar was there.
Yep.
Yeah,
Cancer
and
program, yeah.
he really did a great job. So tell us a little bit about the Cancer
Yeah,
Center.
and I think that opened in 2013.
Yeah.
Again, we started. That was even before this formal relationship with Premier, but that's a partnership with Premier and Dayton Physicians.
Right.
2 of the Dayton Physicians does a lot of the cancer programming and radiology. And again, the conversation was, how do we bring some of those services partner to bring those services to the local community rather than having to drive to Dayton or wherever. And so that was a lot of effort. That is a cancer center that is part of 6 so it's not a standalone, it is a part of that group. You're getting the same physicians, the same service, the same access to their services as you would if you're going to Miami Valley South or downtown to Miami Valley, or they have a couple in the Kettering area. Upper Valley Medical Center, that cancer center is part of the same group.
Right.
So you're getting the same services. But we have the linear accelerator, so you can do radiology, you can do your chemotherapy. Now Dr. McKellar moved on, so Dr. Alicia Reese is head of the cancer program. We are certified by the Commission on Cancer. So we do some chemotherapy and some infusion in our facility, but the majority of that treatment happens just 3 blocks from the hospital.
Right.
So that was and that takes a lot of effort on all sides to agree to invest the capital, to invest those resources, because let's be honest, those physicians are coming from the Dayton market. They're not living in Greenville, but they've chosen to provide that service up here. It's been very successful, and those are challenging. Like everybody else, they had staffing challenges and capital. It's a capital intensive building, but they've made the commitment to keep that going. So we're 12 years into that partnership. So again, it's been good to see that our Dayton partners, I'll call them Miami Valley region partners, are willing to come up and partner with the local hospital to do those things, and we need to continue that because nobody can survive on their own,
Right.
and we've got to continue the partnership.
I do remember though that when Dr. McKellar was up here, that Wayne was really thrilled about that, because Dr. McKellar was like, he had a title, he was like head of some cancer association.
He actually headed that
the-
Commission on Cancer
Yeah, he did.
program for
And,
a year or two, yeah.
And he was did I wonder if, I know he's retired now, did he go back to his farm?
Yes.
I
Yes, he did.
figured he was.
Yes,
Back to the
yes,
farm.
he did.
Yeah, he had an 80-acre farm somewhere down.
Here's the question a lot of people want to know. Wayne Healthcare is one of the larger employers in Darke County. Approximately how many members do you have on staff, and then approximate budget?
Yeah, so we have, if you count all full-time, part-time, casual, our smaller physician group, we're close to 500. 500
Okay.
people. You know, if you want to say a first shift, we're over 200 people that are working, you know, kind of on a daily basis in a full-time capacity. And from a 500 people, we're healthcare is usually one of those that are a higher level of pay to staff.
Right, yeah.
You know, nurses and rightfully so, and all of those. So, you know, we contribute. I mean, it's not a secret, but you know, our payroll is about $1 million of pay. You know, to the community.
Yeah, what's your overall budget then, basically?
So our gross, let's say our net, because it's healthcare is a funny game, funny business. If you look at our net revenue, we're about $80 million of net revenue annually, and the majority of that goes right back. You know, your operating margins are pretty slim,
Right.
So that goes back into your wages and investments and facilities and those types of things. We're pretty equipment intensive organization, and you know, for example, we've built a lot of buildings over the last 15 years. We're pretty well set. I give a lot of credit to the foresight we're not faced with having degrading buildings or needing some major upgrades to facilities. We've got that in place. Now it's equipment, now it's upgrading some of that. You know, we opened our first big addition in 2010. So now all that equipment is 15 plus years old, and you're going to start replacing some of that. You know, for example, we're probably looking at a new CT in the next year or so. That's $1 million plus for something like that. So there's nothing small. So that's also important why we have to plan ahead and make sure we're.
What about the linear accelerator? How old is that?
They actually replaced that.
I thought they
not
did.
that
I wasn't
long
sure.
ago. They
Okay.
upgraded that within the last, I think it was probably right pre-COVID.
I remember when they first got it, I think it was like $500,000 the one they had back when they bought the first
Yeah,
one.
I think they're a little more expensive.
I'm pretty sure they are, yeah.
So you talk about planning ahead, so I assume you have like a 5-year or 10-year plan out there. What's on the horizon? What's coming up? Anything big as we start to wrap things up here?
Yeah, you know, I think one is from a capital facilities type of thing is we're going to invest in equipment and things to help the staff. We did that with Epic. That was a big, it's not only getting on the platform that everybody else is on, but it helps with our workflows internally, those types of things. So that was a huge capital investment for us there. But it is going to be, some of the clinical equipment, making sure we're up to speed on all of that. We did recently an MRI software upgrade to make sure it's at the highest level that it can be. So a lot of that is going to be equipment-based intensive. We're going to continue to manage and grow the orthopedic program in our other surgery lines. That's been a huge thing in the partnership with OA. And then the other thing in the last few years, we brought on a new labor and delivery physician, Dr. Bembry. He came on, I think, in 21 or 22. Dr. Brian Doolin joined us as well, the first cardiologist. We kept him in town. We employed him. So that program has gone well to the point that we added Brandon Bikey as a PA for him. Now it's what do we do next, type of thing. And so we want to solidify some of our service lines for the future and how we provide those services to the community.
How about your physical therapy? Anything you're going to do there? It's already a good program.
Other than hire physical therapists as they come along, because they're stuff tough to find, but that program's always been strong.
It is strong.
And then throw in the orthopedic volume, that's growth, that has gone.
It's probably hand in hand.
Jim Bikey's the director down there, and they're kind of pressed at the seams in that building, but they do a great job. That program's going really well as well. Yeah.
They got good people there too. I can vouch for them.
Well, I know as we run short on time here and everything, I echo what Gaylen said. I think a lot of times people in Greenville and the surrounding area don't realize just what we have in Wayne Healthcare. Because you take a look at other locations, not only in Ohio, but around the country, and they just don't have anything close to what we have. And you guys have done a tremendous job over the years.
Yeah, well,
We
thank
certainly
you.
applaud
And
you for that.
we've been here 103 years,
I
it's going
know.
to be a long time, and we consider ourselves a staple of the community, and what I mean by that is we want to be here, we want to provide the services to the community. We're taking care of our friends and family and neighbors. It's not, it's not the big city.
And we plan on being here,
We
right?
plan on being here. We will be here. We're in really good shape.
Okay,
Well,
great.
Thanks for coming, Jeff, and I will tell you this, you did mention when we first started that you weren't quite aware about what's going on about when Wayne decided to retire. I remember talking to Wayne once when he said he was going to retire, and I said, Wayne, who you got in mind? He said, well, Jeff doesn't know it yet. And that's the truth.
Maybe if Jeff had known that.
That's right. I wish that me.
Anyhow, thanks to Jeff Subler, the CEO out at Wayne Healthcare, for everything you and your staff do for the community, not only, like I said, here in Dark County, but even just around West Central Ohio. So certainly appreciate you taking time out to visit
Thank you,
today.
Jeff.
So,
Appreciate
hey,
it.
on behalf of
Thanks.
Mike
Thanks,
Stegall
Jeff.
and
Thank you.
Gaylen Blosser, I'm Alex Warner. Thanks for Clinton Randall being on the video today, and we look forward to many more years of comforting care from the good folks out at Wayne Healthcare. So long, everybody.